today we are going to talk about sustainable wealth creation, how it starts with your health. So I'm going to talk about the triple burden. You see from the rest of my presentation what I mean when I talk about the triple burden and how it affects artisanal and small-scale miners. Next slide, please. So on the presentation overview, we are going to talk about health and wealth, how they are linked. We are going to talk about what is tuberculosis or TB, what is silicosis, what is HIV. We are going to also talk about the link between TB, silicosis, HIV, and artisanal small-scale mining. And we are also going to discuss how artisanal small-scale miners can prevent TB, silicosis, and HIV. So let me start with health and wealth. What is the link between health and wealth? So there's a saying that goes, health is wealth. There is a link between greater wealth and better health. You cannot separate the two. Yes, most people know that money can buy you better healthcare, but good health is also linked to the ability to create that money, to create your wealth. So those who can afford to spend more on their health, they seem to enjoy their wealth the most. If you spend more on your health, you will enjoy your wealth better than someone who doesn't spend it all on their health. And it is not just about medicines or medical attention, but it is also about the expenditure on maintaining a healthy environment. So you need to maintain a healthy environment so that you are able to live longer and you're able to enjoy your wealth, and you're also able to create more wealth. Bad health costs money. So if you are ill, this reduces your activity. It reduces the work that you do. You have poor productivity. You also have low income. So you need to protect your health for the sake of your wealth. So in this presentation, we are going to discuss 3 diseases that mainly affect the health and wealth of artisanal small-scale miners. We are going to talk about TB, about silicosis, about HIV, how the 3 diseases are linked together, and how you as artisanal small-scale miners can prevent the 3 diseases. So let me start by talking about tuberculosis. What is TB? I know most of you know there's TB, but we need to discuss what tuberculosis is and maybe discuss the misconceptions towards TB. So TB is caused by a bacteria known as Mycobacterium tuberculosis that mostly affect the lungs. It is spread from person to person through the air. When a person is infected with TB, coughs, sneezes, or spits, the other person who is not infected can inhale the TB bacillum. So one of the misconceptions that I'm going to dismiss is the fact that most people think you can get TB from clothes or eating utensils or handshakes. You cannot get TB from that. You cannot get TB from the toilet or from other surfaces. You can only get TB through the air when a person who has TB coughs, sneezes, or spits. So anyone can get infected with the TB bacteria. You can actually have TB bacteria in your body, but because your immune system is strong, you cannot fall ill from TB. So only those with a compromised immune system, such as people living with HIV or silicotic patients, have a higher risk of falling ill with TB, that is developing the TB disease. So everyone can get TB. So when you get the TB disease, the symptoms of TB include the cough. You get a cough, or you can get a fever. You can get night sweats or weight loss. The symptoms may be mild for many months, leading to delays in seeking care and transmission of the bacteria to others. So that is the one flip side of TB. You can get mild symptoms that you may think you're okay, it's just a cough, it's just a fever, yet it's TB and you're spreading the disease to other people. So once you're diagnosed with TB, usually using a chest x-ray or using your specimen, using the microscopy, standard treatment usually lasts at least 6 months. And treatment for TB is usually a mixture of 4 antibiotics. They usually use isoniazid, rifampicin, pyrazinamide, and ethambutol to treat tuberculosis. So that is mainly the disease that puts artisanal and small-scale miners at risk, TB, and it is a deadly disease. If you don't get treated for TB, you will eventually die. There's also another disease that affects artisanal and small-scale miners that is silicosis. So silicosis is a type of lung disease that is caused by breathing in tiny bits of silica dust. So silica is mostly abundant mineral in the Earth's crust. You can get it anywhere. If you do any occupation that involves chipping, cutting, drilling, or grinding soil, granite, slate, sandstone, or any other natural materials, you can be exposed to silica dust. So most miners are exposed to silica dust, which leads to silicosis. So over time, exposure to silica particles causes the scarring in the lungs, which will harm your ability to breathe. And complications from silicosis usually include tuberculosis. So that's the link between silicosis and TB. When you have silicosis, you are more at risk of getting TB. So silicosis is a progressive disease. It usually takes about 10 to 30 years after first exposure to develop. So you might be a miner, you might actually leave work, then 10 years or 20 years later, you start getting sick, you start getting symptoms of cough, progressive shortness of breath, which are symptoms of silicosis. So it's a progressive disease and it takes time to develop. And once the lung scarring has become more severe, there are a variety of symptoms. It's usually a persistent cough, shortness of breath, difficulty in breathing, weakness, fatigue, fever, night sweats, leg swelling, and bluish discoloration of the lips. And because the disease affects the immune system, silicotic patients are vulnerable to developing TB, and they have 3 to 4 times the risk of developing TB. So the current diagnostic methods for diagnosing silicosis is the chest X-ray, which can only detect silicosis in the advanced stages. So you cannot detect silicosis once it starts. It can only be detected in the advanced stages, which means prevention is the only way to manage silicosis. There is no cure for silicosis. It is permanent, it is non-reversible. And the treatment for silicosis is mainly focused on slowing down the progression of the disease and just relieving symptoms, not treating silicosis as such. So what is needed is to avoid further exposure to silica and other irritants such as cigarette smoke. It is very crucial to avoid these two. So silicosis leads to tuberculosis. And artisanal small-scale miners are mostly at prone of getting silicosis because of the nature of their work. Moving on to the next disease that mainly affects ASMs is HIV. I'm sure a lot of you know what HIV is. The full name is the Human Immunodeficiency Virus. It's a virus that attacks cells that help the body fight infection. And these cells are usually the white blood cells. So HIV makes a person more vulnerable to other infections and diseases. It is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex and through sharing injection drug equipment. So, you know, artisanal and small-scale miners, they engage in risky sexual behaviors, which put them at risk of getting HIV. And people living with HIV are more likely than others to become sick with TB. Like I said, HIV attacks the white blood cells, which help the body fight infections. So if you have HIV, your your body's strength to fight TB bacilli becomes weak. So you can become sick with TB. You are 6 times at risk of developing TB if you have HIV. So TB is one of the leading causes of death among people living with HIV. If you have HIV, most people will die because of, if they are living with HIV, they die because they have TB. So it is a deadly disease. The combination of TB and HIV is deadly. So the only way to know for sure that you have HIV is to get tested. Within 2 to 4 weeks after infection with HIV, 2/3 of people will have a flu-like symptom. We have flu-like symptoms, usually fever, chills, night sweats, muscle aches, swollen lymph nodes, or mouth ulcers. So don't assume you have HIV just because you have any of these symptoms. They can be similar to those caused by other illnesses. So what you need to do, if you think you may have been exposed to HIV, you need to get an HIV test. If the test comes out positive, there is medicine to treat HIV, antiretroviral therapy or ART, which reduces the viral load in your body. So ART can help keep a low viral load, allowing you to live a long and healthy life. So now what's the link? We talked about tuberculosis, we talked about HIV, we talked about silicosis. So what's the link with artisanal and small-scale miners? We know that artisanal and small-scale mining, there is usually an excessive exposure to silica-containing dust. There is also overcrowding, there are poor living conditions, there is limited access to primary health services, which poses a risk to TB, to HIV infection, and to silicosis. And there are also serious occupational health concerns that arise due to artisanal small-scale miners' labor intensiveness. We have unmechanized mining methods that result in low mineral yields associated with high exposure to silica-containing dust. There is also poor access to primary and occupational health services in remote artisanal small-scale mining communities. And you know, the nature of your job as artisanal miners, you're highly mobile, and usually you lack awareness on occupational hazards and risks. And studies have shown that there is a multiplicative risk of TB in HIV positive miners that are diagnosed with silicosis. In my previous slide, I mentioned that if you have silicosis, you are 3 to 4 times at risk of developing TB. And I mentioned that if you have HIV, you are 6 times more at risk of developing TB. So if you have both silicosis, you have HIV, you have 3 times, 6 times, which is 18 times the risk of developing TB. So it is a deadly combination to have HIV, to have silicosis. You're more at risk of developing TB. That's why we are talking about this triple burden, these 3 diseases that mainly affect ASNs. They affect the work that they do. And a study in Zimbabwe in selected districts showed that the prevalence of TB in artisanal small-scale miners is 6.4%. And the prevalence of silicosis and HIV combined is 18%. So you cannot create wealth if you have these 3 diseases. Even if you create wealth and later on you find you have silicosis, you are HIV positive, now you have tuberculosis, you won't live long enough to enjoy that wealth that you have created. So there is a huge link between your health and your wealth. TB, HIV, and silicosis are deadly diseases in artisanal and small-scale miners. So prevention is better than cure. Prevention is better than cure. There is need to continuously screen for TB, for silicosis, get tested for HIV, especially a dedicated occupational health clinics. If you have them in your countries, if they are available, please get screened for these 3 diseases. If you have silicosis or have been exposed to silica dust, you need to take TB preventive treatment. Usually they give you a 3-month course of isoniazid, and it will keep you from developing TB disease. If you, let's say you have HIV, you tested negative for HIV, there are also other prevention methods that you could do. Firstly, there is pre-exposure prophylaxis, which they call PrEP. This is medicine that people that are at risk for HIV take to prevent getting HIV. There is also post-exposure prophylaxis, PEP. This is HIV medicine that is taken within 72 hours after a possible exposure to prevent the virus from taking hold. So PrEP and PEP are two medicines that you can get to prevent HIV. You can also use condoms. They are highly effective at preventing HIV and other STDs like gonorrhea. So those are the other preventive measures that you could take if you test negative for HIV. And then for tuberculosis, there are also preventive measures. We all know of the BCG vaccine, which is usually given to children at birth. It is widely used worldwide. So this is one of the ways that you can prevent TB. So early diagnosis also of TB and treatment is also another effective way to prevent the spread of tuberculosis. So once you're diagnosed with TB, we encourage you get started on treatment, because if you get started on treatment, usually patients who are on treatment just after 2 weeks, they are no longer infectious to other people. So you stop the spread of TB if you get treatment early. You also need to manage your environment. You need good ventilation. You need natural UV light that kills TB bacteria. You also need good hygiene, covering of the mouth and nose when coughing or sneezing. It will also reduce the spread of TB bacteria. So have a healthy immune system. If you have a healthy immune system, it's the best form of defense against TB. Don't let your immune system get attacked by HIV, by silicosis, because you will not be able to defend against the TB bacillus. So the triple burden, HIV, TB, and silicosis, they affect your health. As artisanal small-scale miners, they affect your creation of wealth. They affect the way that you're going to live your life, the way that you're going to enjoy your wealth after work. So you need to take care of your health. Thank you very much. That was my presentation. And that slide is just showing you the references for my presentation. Thank you very much.
Thank you very much, Tsitsi. Very interesting indeed. Thank you so much for the presentation. I'm sure there are people with questions in the group. I didn't even know that the way you explained the silica dust, which comes from many of these stones, and this is what we deal with every day. So I think you talked about on prevention. Okay, before I go to the group, sorry, I've got so many questions as well. But when you talked about the prevention, you talked about silicosis. I didn't really hear out what you advise artisanal small-scale miners to do in the prevention of silicosis. This is dust that they inhale while blasting, or can you say a bit about that again on the prevention of silicosis?
Okay, so on the prevention of silicosis, I must have talked about how. Sorry, so I must have talked about how you can prevent when you have silicosis, how you can then prevent TB. But when you have silicosis, usually you need to when you're doing your mining work, you need to have PPE. personal protective equipment. There are masks that are used to prevent further inhalation of silica dust. Most people think you can ingest milk, it helps with dust, but that is not the point at all. You need to have personal protective equipment. You need to wear your masks when you're grinding or when you're mining, when you're doing other jobs that expose you to silica dust. You need to wear those masks. It will prevent the amount of silica dust that actually enters your lungs. Yeah, so that is the main way you can prevent silica inhalation.
All right. Very interesting indeed, Tsitsi. And so I think we really need to get masks in the ASM, in artisanal small-scale mining sector, to make sure when we're drilling and when we're doing these things, the dust doesn't come in. But anyway, we are now open for discussion. We can all come in with questions. I can see some questions coming into the chat box, and you can also raise your hand, and we can put in questions to the group and to Tsitsi and other ASM experts on the group and other ASM miners on the group. In the chat box, I've just seen a question. It's saying, in relation to COVID-19, how vulnerable are the people with TB or affected by silica dust? Then how effective is the drinking of maheu and milk after blasting in ASM? Then what kind of masks are effective for ASM that you can recommend? Lastly, most miners use wet mutton cloth. How effective is this? The questions are actually in the chat box. Tsitsi, maybe you can see them. Maybe let me just bring more questions out before we ask you to speak. Chieza, you can go ahead. Chieza. Chieza.
Oh,
Chichi,
thank you.
Your hand is up.
Thank you, Blessing. Thank you for the beautiful presentation. It's so much of an eye-opener, and I actually have so many questions unanswered, and some of them you have read them out from the chat box, like our myth about maheu, about milk after blasting. But however, I would also want to ask on the management, in case I've got my employees who are HIV positive, we have been diagnosed to have TB, silicosis. How best can we manage that worker? Let's talk about management, because here and there it will happen. How do I manage that employee? And also, how then do we deal with stigma? How do we manage stigma at our mines? Thank you.
Wilson?
Hello. Okay.
Wilson, thank you, Chichi, for the question. Wilson, you can go ahead and ask your question.
All right, thank you. Sorry for that, but I just want to know, how do you conduct research with miners to know the levels of TB and silicosis? Because in Mozambique, we haven't conducted yet, and it's important for us to know this. Thank you.
Okay, thank you, Wilson. I can see Amelia. Maybe after Amelia, then we can maybe give back Tsitsi to speak. Amelia, can you go ahead with the question?
Oh, thank you, Blessing. And thank you for this
topic of presentation and the presenter. This is really very insightful. And I'm even very scared because we see our women, right, all covered in so much dust. But, you know, against even the COVID issues and all of that, like, for instance, what are now the indicators that those people, if you could recall in Nigeria, the issue of the lead poison, those people who have suffered, those community, because mining is still going on in Zamfara, in Niger State till date. What do we do? Because even the Medicine Without Border are pulling out of the mining site, as at information we got recently. What do we do? Because I'm sure because tests like this of this silicosis is not being done. I don't think it's been done around here. Like the last person asked, what kind of research do we do? How do we begin to start talking about it? But what do we do? I'm really like, this is another level of another COVID, because this is even worse than COVID, if you ask me, right? So what do we do? Thank you. Thank you, Emilia. Tsitsi, I think we've got a couple of questions that have been asked. Can I give you the time to answer some of the questions?
Okay, thank you, Blessing. So from the questions, from what I see, most questions are hovering around how to control dust so that you prevent silicosis, and then around how to deal with someone who has HIV and silicosis HOAs. So let me dig deeper into the issue of prevention of silicosis first. Maybe I will answer most of the questions that people have. So the key to preventing silicosis is to keep the dust out of the air. So you need to control dust. It can be as simple as a water hose, just to wet the dust before it becomes airborne. So when you want to control respirable crystalline silica, you need to use dust collection systems if you have them. For many types of dust generating equipment, if you have equipment that you use that generate dust, use dust collection systems. You can just use water. You know, if you're rock drilling, you can use water through the drill stem to reduce the amount of dust in the air. Also, you can use a drill with a dust collection system. So use good work practices to minimize exposure and to prevent nearby workers from being exposed to dust. That is the main way that you can prevent silicosis from entering your lungs. Use containment methods such as blast cleaning machines or cabinets to prevent the dust from being released into the air. You also need to have personal hygiene. So the first step is to reduce the amount of dust that goes into the air. The second step is to have personal hygiene. Personal hygiene practices are essential for protecting your workers from respirable crystalline silica. Do not eat, drink, or use tobacco products in dusty areas. You should avoid that. Wash hands and face before eating, before drinking. Park cars where they will not be contaminated with silica and other substances such as lead. So you need personal hygiene. Avoid dusty areas or eating or drinking in dusty areas. Then you use protective clothing. Use clothing that ensure that dusty clothes do not contaminate your cars, do not contaminate your homes or your work sites outside the dusty area. Change into disposable or washable work clothes at the work site. You know, just wear those clothes. Then when you leave the work site, you can remove them. Shower and change into clean clothes after leaving the work site. Those are some of the ways that you can prevent crystalline silica. Also monitor the air. Air monitoring is needed to measure the worker exposure to respirable silica. So you need to monitor the air where you work. So the use of masks that I was talking about the PPE, it actually comes as the last step of preventing silica. you really need to control the dust in your workplace. You need personal hygiene, you need protective clothing. Then you can also use the respiratory protection. So these measures, if they are used together, you can actually reduce the amount of silica that enters your lungs. And then when the issue of, if you have someone at the workplace who has HIV, who has silicosis, I don't know if you have the occupational health clinics in your countries. If in Zimbabwe, I know we have them. We have these at Gwanda District Hospital, at Gweru. We have them also in Kadoma. We have 3 occupational health clinics in the country. So if you have a worker who has HIV, who has silicosis, whom you think is at risk of developing TB, just, refer them to those clinics. They have better treatment for these people, and they can manage the diseases effectively more than the general health facilities. Then the other issue was to do with, sorry, may you please repeat the other question that came out? Blessing.
Okay. The other question, Tsitsi, was, let me go into the chat box. The other question was, research and collaboration on this topic need to, oh, okay, no. How do you conduct research with minors to know the level of TB and silicosis? Then the other question is, in relation to COVID-19, how vulnerable are the people with TB or affected by silica dust? Then how effective is the drinking of maheu and milk after blasting in ASM? Then what kind of masks are effective for ASM that you can recommend? Lastly, you spoke about it. Most miners use wet mutton cloth. How effective is this?
Okay, so I'll start with the effectiveness of drinking maheu and milk. It is not effective. Like I said, when you inhale silica dust, it goes into your lungs. And when you drink maheu, it's not going into your lungs, it's going into your stomach. So there are different entry points. So you cannot treat silica dust using maheu or milk. So those are some of the misconceptions that are there in the communities, that if you drink milk, then you can prevent that you can treat the dust that enters into your body. No, you cannot. You need these preventive measures that I just talked about that will help you to prevent developing silicosis. So maheu and milk are just misconceptions. They do not work in this situation. Then the other issue was to do with research. How do you conduct research with minors? So I talked about the triple burden. There was actually a research that was done in Zimbabwe on TB, HIV, and silicosis among artisanal and small-scale miners. So they used data that they got from the occupational health clinics that I mentioned in Gweru, in Gwanda, and in Kadoma. So what they just did was to go at the clinics, how many miners come to the health facilities, how many have silicosis, those with silicosis, how many developed TB later on, to get the kind of data and information that they needed when doing a research on TB. Because you cannot deal with ASMs in general just to go at where they work and start to study how they do their life. Like I've mentioned, these guys are highly mobile, and it's very difficult to do a research with ASMs. I'm sure you can agree with me on that one. And the other issue was to do with the COVID-19 and the link with artisanal and small-scale miners. So the link is really huge, with COVID-19, the symptoms of COVID-19 and the symptoms of TB, they are just similar. You have the shortness of breath, you have cough, you have fever, the symptoms are almost the same. So most people who are artisanal small-scale miners, they're at risk of having silicosis, they're at risk of having COVID-19 because the safety measures that are needed to prevent these diseases are not there at their work sites. So they are at risk, and there is a huge link. Even at where we work at the Ministry of Health, we are actually having a grant that is mainly specific towards artisanal miners, COVID-19 and TB and silicosis. So there is a huge link between these diseases, COVID-19, TB, silicosis. I don't know if I did justice to these questions. Thank you.
Oh, thank you so much, Tsitsi. There are more questions coming. Let me start with Irasema, then go to Venance. Irasema from Mozambique, can you go ahead with your question?
Yeah, thank you very much, Blessing. Congratulations for this presentation, Dr. Tsitsi. I've learned a lot with you. I would like to make some comments about the situation that we have in Mozambique. Actually, in Mozambique, we have two centers of occupational health, which are being led by the International Organization of Migration and the United Nations. What happens is that they are monitoring disease, they are screening diseases like TB, and I believe it's all occupational diseases, but mostly they are related to the lungs, for what I've understood. So what happens is that usually these two centers, they make the screening for the miners who come from South Africa, the ones which are working in the mining system in South Africa, and they provide the compensation for those diseases by the payment of the South African miners, the companies in South Africa. So in Mozambique, we still need to implement it not only in SASM, also in general for miners, because we have these huge companies which have not yet assumed the responsibility for the health occupational diseases, and it's a must. And actually, yesterday at the gender strategy discussion that we were having, this lady from the International Organization of Migration, she approached me and said that she was very much concerned that in Mozambique we do not have this kind of occupational centers, and especially that it is important that us as people who are dealing with women in the mining sector should also work with it. So we have already this happening, but it doesn't include the miners that work in the companies here in Mozambique. It's for the miners who worked for the companies in South Africa. But we have the examples of these screening centers, these occupational disease centers, from whom we can actually learn and see how we can establish the centers here in Mozambique, obviously with the blessing of the government and the coordination with civil society. Thank you so much.
Thank you, Irasema. Bennett, can you go ahead with your question?
Okay, thank you very much, Blessing, and the presenter. The presentation was very nice. I really like it, but I wanted to put up some points with regard to Tanzania. You know, we have these ACMs. We have a very good number of ACMs in Tanzania. Most of them are very much scattered and are moving here and there. Depends on how the availability of minerals. So we are very much interested to get the exact number of people who are affected from all the three diseases which you were mentioned in the presentation. That is HIV, silicosis, and the TB. So can we get any international organizations which maybe can assist us to do that so that we can reach a very good number of people? Currently, the situation is whenever somebody is becoming much sick, is taken by whether his colleagues or his relatives to the hospital. That is where now we can determine that, oh, the guy is affected by silicosis or TB. So we don't have much good number of people who are affected by that one, rather than just the individual person or relatives' effort of taking somebody to the hospital for checkup. Thank you.
Thank you, Venance. Earlier on, before we started our discussion, I was actually, there's an ASM leader from Zhishavani Shuvai. I hope she's still online. She actually also spoke about what they are doing as ASM miners in their community. If you're on Shuai, can we give you a minute or two to speak about what you have been doing, TB in the program for TB in mining and silicosis?
Okay, good afternoon. Thanks, Blessing. in our association, in our community in Zhishavani, we have an opportunity for the NGOs. They put leaders into the associations and in the community where we would mobilize people to have screened at some points. Then after that, when you have got TB or silicosis, you go to the clinic straight. They screened at the points. They get the points at the mine and at the mills where people are men, the miners are men. They get there and screen for free. So at there they got silicosis. Some of them have got silicosis, as she was talking to see that silicosis cannot be cured. It's true. We have got workshops. It's like we go through where the presentation of Tsitsi, but we, as I can see, we need more education for the silicosis, because we must all get the information for that TB and silicosis HIV. Of course, now we are gaining more people are being screened, but it needs to be education through all the mining sector. And moreover, for us to gain miners, we are going to put leaders for the miners, not someone else, because miners, some are violent, some are not educative. They need us who know the way to attack the miners to get for them to be treated and screened.
Right. Thank you very much, Shuai. So back to you, Tsitsi. Just some pointers that people have been talking about, and maybe the experience Shuai has been talking about. What advice will you give ASM miners, associations? You can hear their leaders from different mining associations and different mining areas, some who haven't even met this, who haven't even done screening for silicosis or for TB or for HIV. What advice would you give us as SM miners that would go, what would do out there in our mining sites, in our mining areas, and in our mining communities? What advice would you give us? Back to you, Tsitsi.
Thank you, Blessing. Thank you, everyone, for the contributions that you've been making. Thank you, Shuai, for sharing what's happening in Zhishavani at the moment, where you're working with partners. So the advice I can give to mining associations, work hand in hand with the ministries of health, allow them to assist you. Because under the SADC region, we have a grant under Global Fund where we are mainly focusing on mine workers. We have the TB in the mining sector in Southern Africa grant. So most countries here represented, you see that the ministries of health are getting funding to assist, especially artisanal and small scale miners, so that they know much about TB, about silicosis, about COVID-19, about HIV. So they will need to, share that information with miners association, with mine leaders. So allow them, when they come, when they reach out to you, allow them to assist you. We have, especially in Zimbabwe, we have the Targeted Active Screening Program, which is an outreach program where we visit mine sites with a truck, which has the X-ray machines. It has the gene expert machines where we test sputum to check if there is TB. Then the X-ray machines will check if a client has silicosis or not. Allow us, when we try to come to your mine sites, give us the time to come screen people for TB, for silicosis. Also, give your workers the information that they need concerning these 3 diseases, and encourage them to get screened at the nearest health facilities, wherever they are, get screened for these diseases. Also, you can get in touch with even the nurses at the health facilities. If you make time, your miners, they don't have time to actually go to the health facilities. You can actually talk to the nurses at a health facility. Ask them if they can come to your mine site. They can come and they can screen. We usually do outreach programs. They can come and they can screen your miners. So if we work together, we can actually reduce the number of people who have silicosis, who are dying from these diseases. TB can be treated. Yes, silicosis cannot be treated, but we can reduce the effects of silicosis. We can also reduce the number of our miners who actually get sick with tuberculosis. If our miners are given enough information, we can reduce the number of people who actually get HIV. And if you reduce these 3 diseases, we can help our miners live a healthy, longer, satisfying life, whilst at the same time they're enjoying. So let's work with the Ministry of Health. Let's reach out to them. And when they reach out to us, let's allow them to help our miners. So that is the advice that I'm giving to miners associations and mine leaders who are here present. Thank you.
Thank you. Thank you so much, Tsitsi. I can see a hand which is up, and maybe as we go saying our last comments, go ahead, Irasema, then we can just do a last round and say our last comments. Irasema, is that the hand from last time, or do you want to say something?
Thank you so much for the opportunity, Blessing, once again. I would like to ask Tsitsi whether if they are aware of the TEAMS program from SADC, the TB in mining sector in Southern Africa, because here in Mozambique, we are now having some training on community-led monitoring, and the key population is involved, the miners, the Ministry of Health. It's just a pity that last time the Ministry of Mines and Mineral Resources was not invited, but we have mentioned that they should be there. I think that she should be there for the next meetings. And there is a platform that is being created, which is the technical group work that is going to draw how we are going to monitor how the key population are going to implement this platform, community-led monitoring. I think Kundi from Zimbabwe also sent me some information to assist me, because I'm working on the tours as well with other colleagues from this. I just would like to know what is the linkage that you will probably have with teams, if there is, if you're implementing community-led monitoring regarding TB in the mining sector.
Tsitsi, do you want to answer, Irasema?
Yes. I'm sure, Blessing, you can also agree with me that yes, we also are having the community-led monitoring under the teams in the mining sector. A few weeks back, we actually had a meeting with miners and the communities, people that are affected with TB, under this portfolio on community-led monitoring. So most of the portfolios under TB in mines, they're being implemented in a lot of countries in the southern region. Yes, in Zimbabwe, you also have the community-led monitoring. Blessing, you can agree with me on that one?
Yes, yes. Let Kundai answer that. Kundai, are you on? Kundai? Okay, I think Kunda is not connected, but yes, in Zimbabwe, the community, that's why I let Shuvai from Zichavane. I'm sure she has been trained by the, she's been trained into community, into inviting people, the communities, into the engagements and all that. So yes, Teams has been in Zimbabwe, and we've been working hand in hand with them as well. They're just training us in the mining sector. Okay, before we close, let's give each other a minute or two to just wind up our discussion. Let's go around again. Chiedza, you spoke a bit, you asked a bit. Tsitsi, what are your last remarks about the exciting topic, today's exciting topic? Chichi? Okay, Chichi's not on. Is there anybody with something burning as we are winding up? Thanks, Ida, for joining. Ida, are you on?
Can I say something, please?
Yes.
Yeah, thank you so much, Tsitsi. It was a great presentation. Very, very wonderful. I have a couple of things I'd like to say. First of all, be very aware of children on the mine site and their the particular exposure that they have from certain things. And of course, if you have a lung full of silica young, that's even worse for you. But some of the things that I noticed in Madagascar was the need to make sure that the kids on the mine sites get their polio vaccination, and all the basic normal vaccinations that kids would get in the city or wherever in the village. Make sure that the kids get them on the mine sites as well when they do these vaccination things. The other thing is that when you talk about preventative PPE for silica, as Tsitsi said, one of the things that you really need to do is have adapted material. If you know that the rock you're cutting and working with has a high silica content, then you need to wear the correct mask. And it's not just a cloth mask, a surgical mask. If you know that you're cutting a stone with a lot of silica, like sandstone, then you must have the proper mask or you're going to get silicosis. We have a WhatsApp group, and we have a very big group in India that Blessing will know. You're welcome to join that group. They are, in fact, really, really advanced in understanding silicosis over there. So that's worth learning about, because once you get silicosis, as you said, there's nothing you can do. I'd like just to quickly share a screen, and then you can look at this if it's interesting. I made this video, where is it now? Oh, that's noise. I made this video, which is actually related to cutting gemstones, but there are many related issues in it, which are useful for you to know about. And it shows you how it's only 4 minutes long, and it shows you how to protect yourself from dust. And I think one of the things I learned from this, doing the research for this video, was that it's the dust that you can't see which is going to affect you. We can see, you know, dirt and dust that is related to mud and so on. That is not good for you, obviously, but it's the silica crystalline particles that you can't see that will actually harm you, get right down into your lungs and cut them to pieces. So it's really quite insidious and really important. It can easily crop up. So one of the solutions is damping it down with water and wearing the right mask. But make no mistake, there's no cure for it. Once the damage is done, it's done, and it's really terrifying. So that's all I say. I'll put the link for the video in. It's quite a nice little one. And I look forward to hearing more about this. Really exciting to hear the work that you're doing. That's all.
Thank you, Linda. Right. Are you going to play the video? Linda?
No, I think she said she will send the link.
Okay, I think she's playing it. It's there on the screen.
Okay.
Okay, there it is on the screen.
So that was designed for gemstone cutters, but if you imagine sandstone and some of the other particular stones that you have, they're highly full of silica, so you can see the trouble you have. If you're outside, you may be better, but these workers that I was working with, they were in small rooms without good ventilation, and particularly some of them were cutting jasper and agate, and they had their babies hanging in hammocks over the top of their their workstations and so on. So there was a tremendous amount to do, but I think that I put the link in there, and I think that gives you quite a good overview of what you should do.
Thank you very much. Thank you very much, Linda. I'm actually touched that it's very important to share knowledge. You wouldn't know this if you're not in the groups or in the SEC, or if you're not in Delvi Exchange. This is where we are learning certain things. I didn't really know much about silicosis. I didn't even know much. I didn't know that cutting gemstones, inhaling the silica dust can damage. But now, this is knowledge shared. We surely perish because of lack of knowledge. The minute you get to know, you can share with the other person. I've got over 30 women in my circles doing gemstone, some of them trying to cut it now. They don't know the way silica can destroy their lungs. They don't know anything. So it is very important to exchange knowledge. Very important to share with others we live with. So I've seen the importance of knowledge sharing. By today's topic, by our speaker today, Tsitsi, the videos we've got from Linda, and the information we've got from the sharing of knowledge we've done today has been an eye-opener to me. And thank you very much for sharing. Anyone with, just to wind up, we've got about 3 minutes. Our time is almost up. We've got 3 minutes. Is there anyone with a burning question or a burning statement to just wind up our program? I can see some charts here from Amelia. Amelia said, as we are aware, ASM are most time nomadic in nature, and it then means those exposed with the TB, silicosis, and HIV will expose communities with this disease if not mitigated by having also the African Mining Vision and collaboration with CDC to improve health delivery at the primary health center in the mining communities. And another comment from Ida, she says, in Burkina Faso, we are in huge of silicosis cases. Despite the sensitization, the miners refuse to protect themselves. Okay, that is from Ida.
Can I add
as
something?
We are winding up.
Can I just
yes,
add
Linda?
Quickly? Sorry, this is my area. I'd like to say another word about what you mentioned for Delve Exchange. This is Delve Exchange in Central Asia. We have Delve Exchange in India. You are welcome to join that to learn what they're doing. This is a situation we had in one of our Delve Exchange forums that I will never, ever forget. They took the camera into this room full. Every single one of these gentlemen has silicosis. Okay, he has got silicosis, and this is the first time he had the chance to talk to other miners to tell them to watch out and prevent. And it was so moving. There was no future for these men. And what is even worse is that here is a lady that you will meet in Kenya. Her name is Samina, and she works with the wives of the silicosis sufferers, because when they die, they are bonded to work in the man's place. So all these women then have to start working on these quarry sites, and often they get it as well. So there's a huge amount of work going on in India. Rana, one of our coordinators in India, was talking in Brussels last night about legislation in India that will change all this and provide compensation. So, you know, in Africa, we're just starting to wake up to these issues. Let's learn from other countries and not cripple our populations with this awful disease. And we have it in Australia. It's coming now because despite all the wealth that we have, the young carpenters are making benches for kitchens without proper mask, and they're using that granite stone and they're cutting it up for new kitchen bench tops and so on, and they're getting silicosis because it's ignorance, as you said. Absolutely. But I always say water, if you can cut with water, that'll trap the particles. If you can get the right mask, it's worth investing in. But you know, just wearing a cloth mask will not do it because it is so fine. It might stop the ordinary dust, but it's not going to stop the silica if you're in a massive amount of silica. So this area where these ladies are is a sandstone quarry. So of course it's full of sand and so on, silica dust. So yeah, please join the other Delve Exchange to learn more about this. There's lots to learn. So
thank you very much, Linda. Interesting. Thank you very much, Tsitsi, for being our guest today.
Blessing, sorry,
at our
sorry,
forum.
Blessing, sorry, you were giving us opportunity to last remarks as well. Can I come?
Yes, Irasema, but our time is now up, but
yes,
maybe
but
just a few seconds, just wind up.
For sure. Kindly, Blessing, all these meetings have been very, very useful, and I'm learning a lot from them, and I'm going to be part of training so many other women in Mozambique with this Women in Mining thing. So can you please help us with the recordings of these meetings? Is it possible to send us to us? Either whenever we have this kind of meetings, someone will be appointed to do the minutes, because just having a meeting so important like this and not being registered, I believe that there's a lot that will be lost. And I think that's also good for the record of your work. That we have
we're going to share the videos on the group, Irasema, and we can even continue the conversation on the WhatsApp group, but we'll share the recorded.
Yeah, last meeting you said you were going to share, Blessing. I haven't received it. The last video for the last meeting. Can I have the last meeting one and this one, please?
Yeah, we're running a little.
All right, let me just check.
Blessing, just let me say something. Irasema, it's great that you're so enthusiastic. We have 6 regional forums happening every month. So we're just running a little bit behind, but those will be provided very soon. All right. Thank you for that.
Thank you very much, Linda. Thank you.
All right. Thank you. Thank you, everyone. I can see so many comments coming to the chat box. We can put some of the comments.
Blessing. Thank you. Thank you. Titi.
All right, we can put some of the comments on our WhatsApp group, and we can continue the conversation on the WhatsApp group. Thank you, everyone.